ஆமா.
Yes. In case if you are preparing for Australia or New Zealand pharmacist licensing examination, then you need to know that the first part of the licensing exam is OPRA, that is the Overseas Pharmacist Readiness Assessment, that is the OPRA examination. And here I'm going to share you few important things regarding the complete syllabus of this OPRA exam and what are the strategies that you need to follow to prepare this exam and how you can crack this examination in your first attempt. So when it comes to the syllabus of OPRA examination, so you have to go through APC website, Australian Pharmacy Council website, and from there you can download the syllabus and the blueprint of the examination. So when it comes to the topics that are involved in the syllabus, so the topics are here which are mentioned like this. So it will cover the biomedical sciences around 20%, medicinal chemistry and pharmaceutics around 10%, pharmacokinetics and pharmacodynamics around 10%, pharmacology and toxicology around 15%, and finally therapeutics and patient care around 45%. So this is around rough distribution of the percentage, that is how many questions that they may ask you in the examination. But in the examination you may not get the exact same percent that is mentioned up over there, so it varies from exam to exam. And here is the complete syllabus for each topic. Like if you take the biomedical sciences, so here you can see the complete syllabus in detail, and the same goes with the pharmacokinetics, pharmacodynamics, for therapeutics, for patient care, and all the things. So this is the complete syllabus which is mentioned in the official website of Australian Pharmacy Council. So while you are preparing, you need to follow the thing, that is syllabus, which is mentioned in the APC website. And the syllabus, it looks so vast, okay, so I really agree that. So when you go through all that syllabus content, it will be a bit scary for all the students for the first time when they are preparing for this examination. But in the APC website, they also mentioned the references, that what are the references that you need to follow while preparing for this examination. So the most important reference book that I can suggest you is, you can go with Sharjal, the Comprehensive Pharmacy Review by Leon Sharjal. But do remember that Leon Sharjal will never cover all the topics that are involved in this syllabus. Okay, so that's the thing that you have to keep in consideration. So everything is not covered in the Sharjal book. So while preparing for this examination, you have to refer a lot of other resources. So for instance, while preparing for this examination, you must keep in consideration that you need to be aware of AMH, Australian Medicine Handbook. Okay, so there will be a lot of important things or important points that they keep on asking from the AMH for this examination. So you need to be aware about the important therapeutic part that is mentioned in the AMH, and what are the common drug doses or the indications and the contraindications which are mentioned in the Australian Medicine Handbook. So that is one of the important books that you need to refer for preparing for this examination. The other thing is, in OPRA examination, they also ask about the patient care. So when it comes to the patient care, so they may keep asking you the questions about the primary healthcare issues. Okay? So where the patient, they come to the pharmacy and they say that, hi pharmacist, I have epigastric pain, hi pharmacist, I have the headache, hi pharmacist, I have severe constipation. So depending on the patient's condition, we have to recommend an appropriate therapy, where the pharmacist must do an appropriate diagnosis. For instance, if it is a headache, then simply we don't give any anesthetic to the patient. So we need to make a proper diagnosis. We need to ask the appropriate questions to the patient, and then we will decide whether the headache is a migraine headache, or is it a tension type, or is it a cluster type of headache. So depending on the conditions, so we have to recommend an appropriate therapy to the patient. So these are the ones that are involved that you need to keep in consideration while preparing for the examination. Okay? And apart from these things, the most important thing that you have to consider here is most of the questions that they ask in the examination will be clinical or the therapy oriented questions, okay, or the practical oriented questions, like how day by day, like in the day-to-day life, a pharmacist here in Australia, so what are the challenges that they come across, okay, so when it comes to the medications, so those are the things that would be assessed in this examination. So while preparing for this examination, so you also need to keep in consideration about all those facts. So for more updates about this syllabus or any materials that you need, okay, so always I recommend you to visit the official website of Australian Pharmacy Council, okay? And also if you want to know about the exam pattern, okay, and how the sample questions it will be and so on, okay, so you can also visit to Elite Expertise, okay? So our Elite Expertise, we also provide you some free demo classes that how to prepare for this examination, and also we will provide you some free material to prepare for this examination, okay. So these are the things that are involved with this examination. So I hope this video will help you a lot, okay? So to know that what are the important resources that you need to follow while preparing for this examination. And for more updates, please don't hesitate to contact Elite Expertise for your OPRA exam preparation. Thank you so much.
Hi everyone. Is my screen visible? I am not able to look into it.
Yeah, visible.
Yeah. Hi everyone. Welcome to this Elite Expertise OPRA class orientation workshop, and I welcome you all. This is Ashutosh Dikshit, content head at Elite Expertise, and as you all know that this session is going to be an interactive session, an interesting session regarding how you can kickstart your preparations, and I welcome you all. So you are free to interact through your chat boxes, and you can drop your message, you can ask your queries, and can I know how many of you are already prepared with your questions? Like, what are the questions you want to ask to sir and ma'am? You can unmute yourself and mention about your questions. The session will begin in a very short time. This session will be hosted by our expert clinical pharmacist, Arief sir. As many are aware that Arief sir is not only our educator, our mentor, our director, but at the same time, he is a working professional. He works as a clinical pharmacist with Northern Health Hospital, Melbourne. And he will be joining us in a very short time. So you can message and drop your queries in the chat box. What all are the questions you want to ask to sir, and how you expect this session to begin with? Anyone?
Yes, sir, I want to know about where will I get Australian medicine handbook.
Okay. Or if there are other questions, you can just drop in the chat box. It will be there, and in the end of the session, so sir will interact with you. Sir will answer your questions. So we have many candidates who are joining us for the first time as well. And at the same time, I'm also joined with my colleague Rakesh. So Rakesh is someone who works with us. Current job opportunities, it's great. Like it depends upon how you begin, how you approach your pharmacy career. And so we'll answer all your queries in a very short time. So I would like to ask Rakesh. Rakesh is someone who is working with us, and he is also KAPS qualified. So Rakesh, can you just highlight some of the aspects of the OPRA examination? Is Rakesh there?
Yes, yes. Hi, Ashutosh. How are you?
Yeah, Rakesh. I'm doing good.
So,
I'm doing good. How are you?
yes, I am also good. So my name is Rakesh, and I would like to answer each one of your question. If you have any question regarding OPRA exam, as you all know, Arief sir is going to take this session. If you have any question regarding OPRA exam, we are there to help you. We are there to assist you. I think there are few questions in chat box.
Someone
What
has
is the
asked, Priya has asked, do we only work upon elite expertise material or some other material needed? So, Priya, I must tell you that I have interviewed many successful OPRA candidates from last 2 years, and I have found that what they say in their interviews after they clear the OPRA exam is that only sir and ma'am's lectures are enough. You just trust them blindly, and you have to just listen to those lectures whatever sir and ma'am teaches you and they taught you, and it will just echo in your ears during your examination. And if you're aware, then you might have heard about it, like some of our previous candidates have mentioned it a lot of times in the interviews. So it's going to be a super interactive session, and sir and ma'am's lectures are something that help candidates not just understand how to clear this examination, but also understand the in-depth concepts of it. So even after you pass your examination, during your internship periods, or after you were working as a clinical pharmacist or as an intern pharmacist, then it's going to be a super helpful thing. And yes, Rakesh, I wanted to know something from you. Like recently, we heard that there are some universities which are not acceptable by APC. Is this true?
Can you please repeat your question once again?
So Rakesh, I found out that many candidates inquired us about there are few certain universities which I think APC is not accepting. Is this the case? What was exactly the
No.
matter?
It's just a marketing propaganda, not more than this. Every university which is affiliated with the PCI, Pharmaceutical Council of India, everyone is eligible to appear for the OPRA exam. So, as an Indian, we need not to worry. If our university is blacklisted by UCG, then we need to worry. If our university is approved by UCG and our institute is approved by the Pharmaceutical Council of India, then we are eligible for appearing in the OPRA exam.
Yeah, so some people spread this rumor that there are certain universities who are not accepted by APC, but that's exactly a myth. That's exactly a rumor. It's not true. There is no spine to this content. So you must believe Rakesh, because he is someone who does the skill assessment with our team, and he has done skill assessment for many candidates as well. So for those candidates who are here, so how many of you have started preparing for your OPRA examination? You can mention in the chat box, like since when you are preparing for OPRA, and uh, is this your first time? You can mention in the chat box. Yes, your doubts will be resolved. Okay, Priya said it's her first time preparing for OPRA. Anyone else? First time. It's my first time. First time, first time, first time. Me too, me too, me too. Okay, first time. So many candidates are preparing for the first time. I know when we start something, we have many questions, we have many queries, and that's where expertise comes in. Like elite expertise stands for it, because sir and ma'am both are accredited clinical and consultant pharmacists. They both know the in-how of how this examination works and how the inspection is being done, and how you must prepare in a manner that you won't waste your attempts. You clear it on your very first go. As you all know that we boast a successful 95% pass result, which means that if 100 people appear with us, they prepare with us, almost 95 are going to clear this examination. PT requirements for OPRA. Yes, PT is required for OPRA, and we also assist
Sir,
for PT training.
should we write IEL, should we pass IELTS before the opera appearance?
No, no, no. Sir will be answering all your questions. It's just that it will take a very short time for him to join. Like he's there,
Sir is there.
he's just preparing. Yeah, yeah. Rakesh is there.
Sir is also there.
Yeah, sir is there. So I
Arif
welcome
sir is
Arif
also
sir.
there.
So sir, over to you. These candidates are very excited to hear from you. Okay, sir. I think sir is there, right?
Yes, sir is there.
Yes. Thank you so much.
Okay.
Thank you so much, Ashutosh. And welcome to everyone, guys, for this orientation session. So Well, like everyone are here mainly to know about the OPRA examination and what are the further steps that we have to do after once after clearing this OPRA examination. Okay, so these are the ones that everyone are here to know about it. Okay, and well, like I'm going to share a few things about this examination. Okay, so at first I would like to share the slide with you guys. So quickly I will do a short presentation, and then I will clarify all your queries. Okay, so first of all, I hope this slide is visible. And yeah, first of all, I would like to welcome everyone for this orientation session. So which is going to occur today for those who are planning to sit for this OPRA examination and clear the OPRA examination and become a pharmacist in Australia or in New Zealand. Okay, so I would like to welcome to all the candidates. Okay, so for this orientation session, and on behalf of Elite Expertise, I would like to from whole team of Elite Expertise. So we would like to welcome you to this orientation session. So myself, Arief Mohammad, and I'm a clinical pharmacist here working at Northern Health Hospital in Melbourne. And I'm also a consultant pharmacist here in Australia. So currently, I'm a clinical and also a consultant pharmacist working here in Australian hospitals. And we also have Mrs. Harika Bheemavarapu. So she's also a clinical pharmacist. So she's working for Monash Hospital in Melbourne. And also she's a consultant pharmacist. So we both are consultant pharmacists. And we both are working in Melbourne as a clinical pharmacist in the hospitals. Then, when it comes to the Elite Expertise, the main courses that we offer at Elite Expertise are what is the OPRA examination, the first step of the exam for all the overseas candidates to clear. And then the next exam is after clearing this OPRA exam, there will be two more exams. One is the intern pharmacist exam, written examination, and the intern pharmacist oral examination. So just by clearing the OPRA examination, you will become an intern pharmacist, but you won't get the full registered pharmacist. In order to become a fully registered pharmacist, we must also clear these two exams, that is the intern written as well as the intern pharmacist oral examination. So at Elite Expertise, back in 2023, we started Elite Expertise with providing the training for the KAPS examination. And that KAPS, now it has changed to OPRA. So we started providing the training with the KAPS examination. And then later on, we have introduced the Australian intern examination preparations as well. And then we have expanded to Canada, that is providing the PBC training for Canada, and Ireland, okay, providing the training for the PSI for Ireland. Okay, so these are the major, and for New Zealand, especially for the New Zealand interns. So these are the main courses that we are conducting, and we are helping a lot of students in clearing their examination in their first attempt. So as this is the PBC, that is the for Canada. So we also provide the training for Canada, for Ireland, and so on. So since we started back in 2023, so our first batch of the KAPS was in July 2023, where we achieved around 90% of the success. And since then, till now, always our percent scale was above 90. Okay. So then in November 23, we got 94%. Then in March 24, so almost 93%. Okay. Then in July 24, okay, then so on. Okay. Then we entered into 2025, and this is the OPRA has started. The first batch of OPRA was in March 2025. So where we got again 90% of success, and then July 25 was the second batch, again 93%, and the last one was November 2025. Okay, so this is the November 2025. More than 125 candidates have cleared, almost with 93 to 94%. So the one thing that I can say that always at Elite Expertise we have maintained that percentage. Okay, so our success percentage is always it will be 92, 93, 95, and so on, which means that if 100 candidates, if they appear for the examination, out of 195 candidates, they can easily crack this examination in the first attempt. And the other important thing that I would like to tell you is, unlike other institutes, so what other institutes they'll do is, So they will enroll you for the exam preparation. And after enrolling you, in case if you can't sit the examination in June, for example, the next July examination, if you are planning to sit for the July examination, but if you couldn't able to do the July examination, and if you are planning to sit for November examination, then after the July batch is done, then for November batch, again, they will charge the money from you. But at Elite Expertise, we don't do that. Okay. So once you have enrolled, we don't charge any extra fees. Even a single rupee or a single dollar, we never charge with you. Okay? Until you pass your examination, it is our responsibility. But in other institutes, so they will charge for each batch. Okay, so they will say that their fees is bit less. Okay, initially they will show the less fees, but with that less fees, they will trap you and they will keep charging for each batch. So that's going on with the other institutes which are providing the same type of the OPRA training. Okay. Then what about the after OPRA? After OPRA examination that you guys have to do the internship, and during internship also, there will be 2 more examinations. So far at Elite Expertise, there are 250 candidates who have cleared their intern examinations. And now there are total 250 candidates. Okay, they are getting the intern training done at Elite Expertise. Okay, so out of 250, more than 150 are almost like 200 members, they become the fully licensed pharmacist. Okay. So which means that they have cleared their KAPS examination or OPRA, and then they have started their intern pharmacist journey. They have cleared the intern written examination and the intern oral examination, and now they become a fully licensed pharmacist here in Australia. So this is about our intern pharmacist journey. And now coming to the OPRA examination, okay, the essentials of OPRA, July 2026. Okay. So now we are going to discuss briefly about the OPRA exam syllabus, the exam pattern, and the passing score for this exam, strategies for preparing for this exam, and our mocks that we provided to you, our handouts, our assignments, and some team push activities. So these are the ones that we are going to discuss it now, like how Elite Expertise will help you to clear this examination in the first attempt. So these are the ones that I'm going to discuss few things with you now. So let's start with the syllabus, OPRA exam syllabus. So when it comes to the OPRA exam syllabus, so this is the exam blueprint from official website of Australian Pharmacy Council, APC. So in the Australian Pharmacy Council, you can also visit the website and you can see this is the syllabus area or the content area. So where biomedical sciences will carry around 20% of weightage, medicinal chemistry and biopharmaceutics will carry around 10% weightage, pharmacokinetics and pharmacodynamics 10% weightage, pharmacology and toxicology 15%, and therapeutics and patient care up to 45% weightage. So this is how the whole syllabus is distributed. Okay? So roughly around you will get the questions in this pattern. Okay, around 20% of the questions will be from biomedical sciences, around 10% from medicinal chemistry and biopharmaceutics, 10% of questions from pharmacokinetics and pharmacodynamics, pharmacology and toxicology 15%, and therapeutics and patient care up to 45%. So this is how that your exam pattern or the syllabus distribution it would be. Okay. Now, when it comes to the type of the questions, that what type of the question that you will get. Okay. So you will get around 55% of the questions are recall-based questions. Recall means remembering. Easily you can remember. Okay. So where they don't ask you any difficult level questions. Okay. They are the simple, as per the Bloom's taxonomy. So these are the simple recall-based questions. So it will carry around 55% weightage. Then the second type of the questions are the comprehensive based. So here you have to think a bit in order to answer the question. The questions, there won't be any straightforward. So you have to think a bit to answer these questions, and it carries around 30% of weightage. And 15% will be application based, where you have to think more and apply all the knowledge that what you have learned. Okay, then only you can able to answer these questions. And it carries around 15% weightage. So in this way, roughly around 55% are direct straightforward questions, around 30% will be comprehensive, and 15% will be a application type. And you have to focus on all the three components, all the three type of the questions. So don't think that like if we focus only on the simple questions, the straightforward recall based questions, then we can crack this exam. No, so such things, they won't help. So while preparing for the examination, we have to prepare in a proper way, okay? Like in a case study based scenario, then only easily we can answer the question, like what will be the way that the examiners they ask to us. Okay, so these are the important things that we have to keep it in consideration, and this is the rough distribution of the percentage, approximate percentage on what type of questions that they ask. Now, when it comes to the syllabus, the whole syllabus, okay, so in biomedical sciences, you will have physiology, pathophysiology, microbiology, immunology, and disorders affecting the body fluid, symptoms of other disorders. Okay, so all these are the things that are included in biomedical sciences, which carries 20% weightage, which means that you need to study all these core components for your biomedical sciences. Okay? Then, when it comes to the medicinal chemistry and biopharmaceutics, in medicinal chemistry and biopharmaceutics, they mainly ask about the biopharmaceutics rather than medicinal chemistry. They won't give any structure-based questions, but most are the application-based, where both the chemistry and biopharmaceutics both are in common, like physicochemical properties of the medications, okay, absorption, distribution, metabolism, and excretion, pharmacokinetic properties, then formulations, then drug stability, solubility, drug formulation, and pharmaceutical microbiology, like preservatives, antimicrobial agents, and sterilizing procedures. So all these are the ones that are included in this component, that is medicinal chemistry and biopharmaceutics. And then pharmacokinetics and pharmacodynamics, which carries 10% weightage, where drug metabolism, principles of pharmacokinetics, factors affecting drug impact, evaluation of pharmacokinetic data, pharmacokinetic data in treating patients, and drug metabolism. So all these are the things that will be included under pharmacokinetics and pharmacodynamics, which carries 10% weightage. Then pharmacology and toxicology, like where receptor theory, mechanism of action, adverse effects, drug interactions, toxicology. So everything will carry around 15% of weightage. And finally, around therapeutics and patient care. So where in therapeutics, you need to know about the calculations, therapeutic-based calculations. So here, and you also need to know about the primary healthcare and selection of appropriate therapy. Okay, safe and effective use of medication means you have to have the therapeutic knowledge. So where you have to select the appropriate therapy for the patient, medication for the patient, and harm minimization, confidentiality, and health promotion and disease prevention in Australia. So these are the core areas where you will get questions. So when you look at the syllabus, the whole syllabus, for example, starting from biomedical sciences, you see, so there is a huge vast syllabus will be there. And also, if you visit the APC website, so there will be a lot of references that are included. And in case if anyone have to prepare for this examination, they have to prepare for all those references and all those things. Okay, but you need not to worry because you are with elite expertise. So as long as you are with elite expertise, so you need not to worry about preparing all these components. We make it simple for you. We simplify each and every things, and we will provide the concepts to you so that it becomes much easy and easily will crack this examination in the first attempt. Okay, so don't get scared by looking at the syllabus. Okay, so it is our responsibility to cover all the syllabus in 3 months. Okay, in total is 3 or 3.5 months will be present. So in this 3.5 months, we will cover all the syllabus, and we will make sure that you will sit the examination with full confidence. And what is the passing score for this OPRA examination? So there is no particular passing score for this examination. Okay, so for this examination, sorry, someone's mic is on. Can you please turn off your microphones? Okay, so what is the passing score for this OPRA examination? There is no particular passing score for this examination. Okay, so like earlier when it was the old pattern, like in the KAPS examination, 50% was the passing score. Okay, so if someone scored 50% in their KAPS examination, then they used to clear this exam, their KAPS exam. But now in OPRA, there is no such particular passing score. So because it is completely dependent on the RASH methodology, okay, where scale scoring system is adopted. Okay, so there is no particular percentage. Okay, but it completely depends on how difficult that you get your paper. Okay? So if your paper is more difficult, then your passing score will be less. If your paper is quite easy, then your passing score will increase. Okay, so this is how it will be designed. So you need not to worry about what is the score that you have to score. You have to do just, you have to worry about how best you perform in this examination. Okay, so you have to try your best, you have to give your best. Okay, and as long as if you can get around 70 to 80% in the mocks that we conduct to you, if you get around 80% of score in the mocks, then 100% you will crack this examination. So you need not worry about all the passing score and how much that we have to get. Okay, so just if you can get around 80% in the mocks, then easily you will crack this examination. Now, coming to our teaching methodologies. So elite expertise. So the first thing, the most important thing, why so many candidates, they clear this examination. If you look at the other institutes, they are also providing this training. Okay, but when you look at their passing percentage, or when you look at the number of candidates they have passed, they have only 10 students pass, or 20 students, hardly around 30 students. But at elite expertise, 130, 150, 160. Okay, so what is the difference here? Okay, so which means that clearly it indicates that from other institutes, if 100 candidates, if they appear, only 30 or 40 they will clear the examination. But from elite expertise, if 100 candidates they are appearing, then 90, 95 candidates they are clearing this examination. Okay, so what is the main thing here? What is the important thing? What is the main formula here that we follow at elite expertise? The main thing is that we spend lot of hours with the students. For each batch in other institutes, what they will do is they will finish the whole syllabus in 50 hours or 100 hours. Okay, and then they will wind up. Okay, they will say that, okay, all the syllabus is done. But elite expertise, so we will take around minimum around 400 hours per each batch. Okay, and we design the teaching in such a way that in the first 2.5 months, we will finish all the core syllabus. The main syllabus will be done. And the last 1 month, we will completely put it for the revision, where we will keep on discussing a lot of MCQs, a lot of revision will be done. Okay, and all the important points, MCQs, so everything that will be discussed in the last 1 month. Okay, so this is the main core strategy why most of the candidates, they are clearing their examination in their first attempt at elite expertise. Okay, so the important thing here is one thing. Okay, so you have to see how many number of candidates they are clearing the exam while selecting any institute. Okay, how many number of candidates they have cleared the exam, and the second important thing is that how much they are charging, and are they providing a lifetime validity for the course. Okay, at elite expertise we are providing the lifetime validity, which means that in case by any chance, okay, 5% they will sometimes they will fail. Okay, 5% of candidates, of course, they keep on failing, but 95% they will pass. So that 5% of candidates, okay, they need not to worry, because we provide the full support to them. Okay, even though they fail in the first attempt, they will clear the exam in the second attempt, and we don't charge anything from them. Okay, so these are the few important things that makes all our students succeed in their first attempt. Then this is our weekly planner for the 14 weeks. We designed that for week 1, we'll take some introduction and the basic pharmacology. For week 2, respiratory system. For week 3, physiology of the cardiovascular system. Week 4, we continue the cardiovascular system. Week 5, pharmacokinetics. Week 6, pharmacodynamics. Week 7, CNS. Week 8, infectious disease. Week 9, cancer, chemotherapy, GIT. And week 10, musculoskeletal system and endocrinology. Then week 11, 12, 13, 14, the last 4 weeks, it is completely a revision session. So during the last 4 weeks, especially the last 3 weeks, what we do is, so we will keep taking the classes from morning to till night, 9:30, 10 o'clock. Okay, so every day you will be having the class from Monday to Sunday. Okay, no breaks at all. Okay, so every day you will be having the classes from morning to till night, 9:30 and 10. Okay, so morning in the sense, I'm telling about the Melbourne time. So in Melbourne time, we will start at 12:30 p.m. Melbourne time, Australian Melbourne time, and we'll keep conducting the classes till night 9:30 or 10 o'clock, okay, with appropriate breaks. For every 2 hours there will be a break that will be provided to you guys, okay. So this is how the plan, and we train the candidates, okay, for clearing this examination. And what are the strategies for preparation for those who are preparing for this examination? So what you have to follow, okay. So I strongly recommend to attend the live classes, okay. So because from live classes you will learn a lot, okay. And also pre-learning modules, we will provide some pre-learning modules. So which means that before you attend the live class, you have to attend that pre-learning modules. You have to learn that pre-learning modules, okay, and complete your assignments. So I will keep on giving a lot of assignments, okay? So you have to finish all those assignments and need to do the mocks and grant test, okay, as many times as possible. So we have a separate platform for mocks and all the grant tests. So you have to do the mocks and grant tests from the ProProfs that I will show you again quickly. And you have to refer the handouts. We'll provide all the handouts, which means that you need not to refer any other textbooks, okay. So you need not to open any other books, any other materials. So just you need to follow whatever be the things that we teach and whatever be the handouts that we provide. So those things that you have to keep following up, those things that you have to keep studying from those handouts and from the lectures, you have to prepare for this exam. So which means that you need not to open any other books. And we always follow the standard references while preparing our content in the sense our slides and everything. So we follow all the standard books, like especially the Australian Medicine Handbook, AMH, and therapeutic guidelines and up to date. So these are the main standards, that Australian based standards that we follow, okay, because as we both are working as a clinical pharmacist in Australia, so we know how the standards that will be in Australia. So what practice changes that keep on happening every day-to-day life, okay. So those are the things that we will incorporate in our slides. Those are the things that we keep teaching to all our students in each class every day, okay, in day-to-day classes that we'll keep on teaching all these things. So which means that you guys need not to worry about opening any of the textbooks or any of the guidelines. So that's our responsibility. We will prepare everything from the standard books and the standard guidelines, and we will make you to clear this examination in the first attempt, okay. So this is the format of the assignment. So we'll give some assignments to you, okay, for during your course, okay. And this is the ProProfs where you will be doing the mocks, okay. So all the mocks as well as the grant test you will be doing in the ProProfs. It's a separate platform, so where it is completely timer based, like how the original exam it would be, okay. So how the original examination it will be, which is a timer based one, in a similar way that we will organize it in the ProProfs. So it is completely timer based, and there you have to practice the mocks, okay. So which gives a simulated, it will be quite simulated to that of the original examination, okay. So these are the few things, guys, that you need to know about this OPRA examination. And soon we are going to start, that is tomorrow is Wednesday. So from Wednesday, we are going to start our first class for OPRA exam preparation for this July 2026, okay. So now it's the time for the Q&A session. So if you have any questions before Harika ma'am, she comes. So if you have any questions to ask me, then you can ask. Anyone from the team
Yeah.
to
Hi,
coordinate?
sir. How are you?
So there are many questions.
Yeah.
Hello.
Yeah. Hi, Priyanka.
Hi,
Hi.
sir.
Yeah.
I wanted to know that are we allowed to take the printout for the handouts that you provide or no?
Yeah. You can take the printouts. You can take the printouts for all the handouts.
And as I'm thinking to give exam in July,
Yeah.
so is it like the classes tell that you are like good to go for July exam, or like do we refer to you or Harika ma'am for that, like personally?
No need. If you are planning for July, then you can straight away go for the July. So because you have 3 months time, okay, and
Yeah.
this 3 months is more than enough for you to prepare for this examination.
Okay. Okay. Thank you, sir.
Yeah, you're welcome.
Sir, you said that there's classes from all week round, from morning to evening. So is the
Yeah.
classes repetitive? Imagine you took a session in the 8 o'clock, 8 to 9 session. Is the same content being repeated throughout the day, or is it new
No. So
topics?
those classes are not for they won't start now, only 3 weeks before the examination. So that classes, they will start only 3 weeks before the examination. So because what happens is 3 weeks before the examination, everyone, they take the day offs, okay, and they will be focusing mainly for preparing for the examination. So we conduct those classes only just like 3 weeks before the examination for each batch. So it will be going on for each batch. For every batch that we will take, like for the last 3 weeks, we will take the full-time classes for them.
Sir, and because of this geopolitical tension, yeah, is there any restrictions for the candidates to come into Australia?
So you need not to worry about those things. Okay, so those things that if we keep worried, because I don't think such things will impact you. Okay, because Australia is not at all involved in it. Okay, and Australia is quite far away from all those issues, all these geopolitical issues. So you need not to worry about those things. Okay, so it will never impact on Australia.
The last question from my side, I won't ask you
Sure.
again. Sir, if an immigration consultant is telling you to apply through as a pharmacy technician by making a experience certificate using pharmacy technician, what is your suggestion before going for pharmacist exam? What will you suggest?
Yeah, what you can do is, if you want now, you can apply lodge for pharmacy technician. Okay, but after you clear your OPRA examination, okay, until then, put your EOI as pharmacy technician. But after you clear this OPRA examination, so you can also lodge for the pharmacist. Okay, so you have to withdraw the technician one and you have to lodge for the pharmacist one. So if you want the as a pharmacy technician, in the sense, just you have to do an extra assessment, that is the skills assessment, to be done by the VETASIS. So you have to get it done through VETASIS, and then you can lodge your application as a pharmacy technician first, but see how it goes. But once you crack this OPRA examination, then you can lodge your application as a pharmacist.
Sir, namaskar.
Yeah, hi.
Yeah, hi, sir. Actually, sir, I wanted to know about that 407 training visa is available after completing this, as my age is 40.
40 means, okay, you can still migrate. You have 5 years time, only 5 years time, okay? Because 45 is the last age for getting permanent residency in Australia. So 40 means, yes, you can do, but 407, the main thing here is it completely depends. So I can tell you one thing, guys. Last year, 2025, 60 students from Elite Expertise, they have entered into Australia on 407 visa. Okay, 60. Okay, 60 is not a
Wow,
joke.
that's great.
So 60
That's
is not a
great,
joke.
really.
So 60 members, they have entered into Australia on 407 visa. So in the whole year 2025. So, but the thing is, they tried by themselves. Okay, so like what you have to do is, after clearing this examination, you should not wait for the government to give the invitation to you. You have to keep trying by yourself. Okay, so you have to keep sending the emails to all the employees which are here in Australia. Especially you have to target the regional areas, okay? Employees in the regional areas. So if you keep employers in the regional areas, so if you keep targeting the employers in the regional areas, so we need to keep sending the emails to them in a proper way. And also your resume should be strong enough. Okay, if your resume is strong enough and if you do a proper follow-up with them, then definitely one day they will ask you to come for interview. Okay, so they will do the Zoom interview. And in that Zoom interview, if you can able to impress them, okay, that interview will be for at least 30 minutes or 40 minutes. And if you could able to impress them, then 100% they are giving the opportunities given for the overseas candidates. Because what promise that the overseas candidates that they are giving to the employers is, after I finish my internship, I can stay with you for a long term. So that's the promise that they are giving it to the employers. So that's how they are entering. And so far, as I told you that, as you can see here, 250 members are getting trained. These are all the interns. Okay, so currently they are getting trained. They cleared their KAPS examination from Elite and also the OPRA examination. Most of them, 200 and at least around 230 members, they have cleared the KAPS or the OPRA examination from Elite Expertise, and now most of them they entered to Australia. So either on the sponsorship, direct sponsorship visa like 482, or getting these 407 visas.
Okay, sir. Thank you
Good.
for information. Now I want to know, sir, Australian medicine handbook, sir. Can we get, or just we need to follow you only,
No,
sir?
no, no. You need not to buy the Australian Medicine Handbook. AMH is not at all required for you at this stage. Okay. So because we are preparing all the notes, all the material by referring the AMH. So which means that you need not to purchase the AMH. Okay. So in order to buy the AMH, it will cost you around 700 Australian dollars, okay, or something, 700 or 800 Australian dollars. So you need not to buy, you don't waste that money. So just follow.
Okay. Thank you, sir.
Okay. You're welcome.
Hello, sir.
Yeah, hi.
Sir, I have a question. I'm a student who want to appear the November exam. When is the right time to do the skill assessment?
Okay. So you are planning to sit for exam in November 26?
Yes, sir.
Okay. So what is your question? You want to
When
do,
is the right time to do the skill assessment?
you can start the skill assessment now itself. Okay. So because once you get the skills assessment done, you can give the examination at any time. You will be having like 3 to 5 years validity. So for that skill assessment, so you can start the skill assessment now itself. So get that skill assessment done. And once the skill assessment is done, then they will give the letter to you, to your email, asking to sit for the exam. Okay? Then you can, whenever you are ready, you can sit for the examination.
And I want to ask you about the PT also, sir.
Yeah.
When should I start preparing for the PT?
PTE, like PTE, it's for Australia, there is no mandatory condition. Okay. So which means that you can sit for the PTE even after clearing the OPRA examination. Okay. So even after you clear the OPRA examination, you can sit for the PTE. So it doesn't matter, at any time you can do the PTE, because for this examination, OPRA exam, Australia won't ask you the English score, English language score. But if someone is giving the same exam for New Zealand, then yes, New Zealand will ask the English language score first. Okay. So then if you submit the English language score, then only New Zealand will allow you to sit for this OPRA exam. But Australia, there's no such condition. You can give PTE at any time.
Thank you, sir.
Yeah, you're welcome.
Hello, sir.
Yeah.
I'm planning to write exam in the July.
July. Okay.
So, on what basis I should write the exam? Either I am confident to write the exam or not. On what basis I should be confident?
So one thing, Ramakrishna, like in case if you are prepared well, okay, so I'm not sure how you are planning, but if you are with Elite Expertise and if you prepare for 3 months, okay, so this 3 months would be more than enough for you. You will get that confidence, 100% you will get the confidence to crack this examination in the first attempt. Okay, so that's the level of confidence that I can tell you. So if you prepare well with us, then 100% you will crack the examination in the first attempt.
Okay, and how many times we need to watch your classes per day when we are watching the live class?
Yeah. So after live class, like at least once you have to revise the same class. Okay, So after you have completed, after you have watched that live class, okay, so at least once you have to revise that class. So that's quite important. Okay, so if you keep doing it from day one, then every day that if you keep spending at least 3 to 4 hours or minimum at least 2 hours time for preparing for this examination, then 100% this 3 months is more than enough to clear this examination.
Sir, I have one more question.
Yes, Suraj.
Is there any other way to pay you, like through UPI? I'm facing difficulty through Visa and Mastercard.
Sorry, Suraj, your voice is not clear. Sorry.
Hi guys, for payment related issues, you can connect with our admin team and they will assist you. And for those who want to ask their question, they can drop their message on the chat box. We will pick one by one. So someone is asking, so Seraman is asking, do I happen to have an PT test score in order to apply for an internship pharmacist job?
Yeah, so to apply for the intern pharmacist job, yes, definitely you have to have this PT score. Okay, so PT score is mandatory while applying for the intern pharmacist job.
Meena Shah, you were asking something like Meena Shah?
Yes, sir. What is the difference between this Australia and New Zealand OPRA registration?
Okay, so there is no difference. Exam is the same for Australia and New Zealand. So both the countries, examination is the same. Okay, Australian Pharmacy Council will conduct the exam for both the countries, for Australia and for New Zealand. But there is some difference in the registration pathway. While you are registering in the country as an intern pharmacist, if you want to become an intern pharmacist, so there is some difference there. I will explain you briefly what is the main difference. So Australia, at first, it won't ask you to submit the English language score. Okay, so you need not submit any English language test. Okay? So straight away, you can, once you get the eligibility, you can sit for the OPRA exam and you can clear the OPRA exam. But New Zealand, at first, you have to submit the English language score, then only you will become eligible to sit for the OPRA exam. And Australia, it won't ask any work experience, even if you have the 0 work experience. Okay, still you can become a pharmacist in Australia. But New Zealand, you must have minimum work experience. Okay, so that is mandatory for New Zealand. You must show that minimum at least 1 year of the work experience. Okay, as a pharmacist, then only New Zealand will allow you to become a pharmacist in that country. So. And Australia, the further examinations while doing the internship, there will be 2 exams, intern written and the oral examination. But New Zealand, while doing the internship, there will be 1 exam, that is the OSCE. OSCE consists of total 10 stations. Okay, it's a 10-station OSCE exam. So these are the differences between Australia and New Zealand. The pathway is different, but when it comes to the OPRA exam, the first exam, OPRA exam is quite common for all the country, for both the countries, for Australia and for New Zealand. Both the countries, the exam is same.
Yes, sir. Preeti Lakshmi is asking something. It's a yeah. Hello.
Sir, I have a couple of
Preeti
questions.
Lakshmi.
Are you able to hear me?
Yes, Shivansh.
Sir, I'm still a bachelor student and I have still my last semester exam next month.
Okay.
But sir, can Arief sir, you can guide me for start my preparation from now?
Yes, you can start, Shivansh, you can start your preparation from now itself. Okay, so if you start the preparation from now itself, then you will have like enough time. You can keep preparing. Okay, and you will have plenty of time to prepare, and then later you can decide. Okay, so you can decide to like to move to which country. So mostly I recommend to move to Australia. Okay, so but in case if you want to move to Canada also, you can switch over to the Canada. Okay, so we don't charge any extra fees for you. With the same fees, you can switch over to Canada, or if you want to switch over to Ireland, you can also switch over to Ireland. Okay, so our New Zealand pathway, so anything, it doesn't matter. So but you can at first you can start the preparation so that you will have an idea, everything about like how and what you have to do and so on.
Sir, I have already decided after a couple of research that I have to move to Australia. And sir, I have some more questions like how many students appear per attempt on an average for OPRA exam, and how much of them clear the exam and work as registered pharmacist in Australia?
Okay, so I'm not sure like how many worldwide, how many they will appear. Okay, so many candidates they will keep appearing for this examination, but only from elite expertise itself, like roughly around 130 or 120 candidates they will appear for this examination for each batch. Okay, and from elite expertise, like if 100 candidates they have appeared, okay, at least like 50% of the candidates they are starting the internship. Okay, so they are starting the internship and they are enrolling and they are finishing their internship as well.
Sir, also about an internship, is that internship paid, or we have to pay our basic expenses during the
No. So
internship?
it's a paid internship. So you will get around $29 at the moment. The market price is $29 in Australia per intern pharmacist. So per hour, for every hour, you will get $29, and you will be entitled to work for 38 hours or up to 40 hours in a week. Okay, so per week you can work up to 38 to 40 hours in a week, and the pay rate will be around $29 to $30.
Sir, can
Sir,
you?
amount of the classes?
Sorry, Rashti.
What is the fee structure of the classes?
Yeah, so our team members, they will message you. Okay, so we will message you and you can have a chat with them. Okay, and also we will provide the free demo lectures for you, Drashti. So you can go through all the free demo lectures, you can watch them, and then only you can take your decision. Okay, so there is no compulsion or no force that we impose.
Okay, thank you, sir.
Yeah, you are welcome.
Hello,
Sir,
sir.
one last question.
Yeah.
One last question, sir, from my side.
Yes, Shivansh.
Sir, what is roadmap after completing internship, and what are the challenges commonly students face, and how to tackle them?
So the challenges in the sense, Shivansh, one thing, okay. So after clearing this OPRA examination, the main thing is that everyone, they have to do the internship. Okay. So all those who have cleared the OPRA examination means 100% you, for 1 year, you have to work like an intern pharmacist. And while looking at the internship, it takes some time. It may take like 3 months, 4 months, 6 months. Okay. So it takes some time to find out the internship. So I can tell you my example. I cleared this OPRA examination in, sorry, someone's mic is on. Can you please, our admin team members, please make sure all the microphones gets turned off. So I will give you my example. So I cleared my KAPS examination. So OPRA is nothing, but in those days it was KAPS. Okay. So I did this examination in 2016, in the year 2016. Then after clearing this KAPS examination in 2016, I applied for permanent residency in Australia, PR in Australia, and I have to wait almost 2 years. Okay, so 2 years to get this PR. In those days, like it was not quite easy to get the PR, and also in those days, like it was not quite easy to get these sponsorships, okay, sponsorships from the employers and so on. So I cleared the examination in 2016, and in 2018, I moved to Australia. After moving to Australia, at first I moved to a state which is known as Tasmania. Okay, so Tasmania in Australia. So I moved there and I tried for the internship in Tasmania, and almost for 2 months I was in Tasmania. I visited each and every single pharmacy in Tasmania, okay, but I didn't get that chance to, like there was no vacancy at that time in Tasmania. Then I moved to South Australia, okay, so it is another state. I moved to South Australia. Then I went to all the pharmacies in South Australia. I didn't get any chance, okay, so almost like 3 months I have waited for the internship. Then finally I moved to Victoria. So Victoria is nothing but Melbourne is the capital of Victoria. So in Victoria, I moved to a small village. It is a small village. Okay, so there I approached them. I approached 2 or 3 places in Victoria, and that small place they offered me the internship. Okay, so which means that by being in Australia, it took around almost 3 months time for me to find out that internship. Okay. So this is how that we should never give it up. We need to keep trying. Okay. So until we reach our target, we should never keep, we need to keep trying. So for these 3 months, what I did, I did some normal local jobs. Okay. So local jobs in working in the restaurants here, there. Okay. So for the 3 months, just for survival purpose, I have done all those things.
Sir,
Then,
those jobs are able to complete your normal rent and normal expenses for the living cost.
sorry, for
So the normal job you have done before your internship
Mhm.
are able to fulfill your basic requirements for that
Yeah,
period.
yeah, because you see, the pay rate will be the same. Okay, even if you do those jobs, also you will get the same pay. Even if you work as an intern, also the pay rate will be the same. So, for example, if you go and work in a grocery store now in Australia, the pay rate is $27. Okay? Even if you work as a pharmacy intern, the pay rate will be same, like $28 or $29. Okay? Almost same. But where the difference it comes, the main difference it comes when once you become fully licensed pharmacist. Okay, so when once you become a fully registered pharmacist, then your pay from $29 straight away it will jump to $45 per hour. Okay, so it will go up to $45 per hour, and then from there, depending on your skills, your managing capabilities, okay, and your experience, so it will keep increasing. So in that way, the salary will go higher and higher. Okay. So currently, I'm in hospital like I'm a grade 2 year 4 clinical pharmacist. So currently, my pay rate is around $64 per hour. Okay, so that is my hourly pay rate. So when I started my internship back in 2018, my pay rate was $21. Okay. So that time per hour is 21. Now it is 64 per hour. Okay. So this is how the difference it comes. So yeah, we have to sacrifice few things. Like internship means there you will get the money. Okay. So with that money, it's quite enough. Okay. So you can pay your rentals, you can survive here in Australia. You can also buy a second-hand car, okay, a normal second-hand car, and you can survive for that 1 year. Okay. Then after that, as the pay it increases, then you can upgrade your lifestyle.
So you moved with your family, or you was alone?
No, no. I moved with my family, myself and my wife. So we both moved here in 2018.
So still, so during that time, your part-time jobs was sufficient enough to take care of the family things, or
Yeah,
is your
enough.
wife
It was enough.
professional
Yeah.
worker?
Yeah, it was enough. Like we both, like even she also worked. Okay, so we both worked together, and yeah, that was quite enough. And
So from
anyhow,
from
like
your
anyhow, like I can say that we can manage our life. Okay, so I can't say that we can spend a very good or high standard life initially when we were as an intern, but yeah, we can manage with that money. We can manage it.
your experience since 2018, you said I can understand you had struggled a bit for getting an internship position. So now
Yeah,
it is 2026.
yeah, almost like
The you know, how many pharmacists are already there in Australia? So
uh,
a newcomer will face more difficulties. That's for sure thing, right?
yeah. So I can tell you another example. So in 2018, okay, so I'm giving you an example of a hospital that where I'm working now. In 2018, there used to be 23 pharmacists in the hospital. Okay, so in the hospital where I'm working as a clinical pharmacist, total 23 pharmacists. But now in the same hospital, the total number of pharmacists has increased to 98. Because the requirement has increased. They are expanding the services. Okay, so from 23 it went up to 98. And the hospital where ma'am she's working, can you guess how many in Monash, how many pharmacists they will be? Just guess in a
Maybe
single
150.
hospital.
150.
No, around 450 or something. Yeah.
Only 400 pharmacists in that hospital. So how many bedded hospital it might be, sir?
Yeah, because
It
they
is.
have many branches. Okay, so multiple branches. Like pediatrics is a separate branch. Okay, women's health is a separate branch. Okay, so cancer or oncology is a separate branch. Cardiac care is a
Okay.
separate branch. Okay, so in that way, it's a huge. Like I can say that same in Monash. Back if you look at in 2010 in Monash, the total number of pharmacists will be around 30 plus or something, but now it went up to 400 plus. Okay, so which means that as obviously the population increases, the number of pharmacist outcome will increase, but at the same time they are also expanding the services. So we can't compare with those things. Okay, so it completely depends on how well we compete in this field. So that's the important thing. If we can compete well in the field, then 100% we can secure the position.
Sir, is the pharmacist, as you mentioned, there's a pediatric division in US and all, there's specialization. You go deep into that particular category, like for example, oncology medicine. So in Australia, is it like that, or you're just like a community pharmacy or a hospital pharmacist? Are you going to get specialized areas, or you can just opt for the normal pharmacy?
Yeah. So if you are working in the community pharmacies, then there won't be any specializations. Okay. So just they will work as a dispensing and providing counseling, and they also have their own. It completely depends on how well they can expand their career in that field. Okay. So even in community pharmacies, they can do home medication reviews. Okay. So home medication reviews are something like only accredited or certified are the credential pharmacists. They can do that home medication reviews. Okay. So they can do the home medication reviews. They can do the med checks. Okay. They can do vaccinations. So they can do a lot of other services even in community pharmacies. Okay. And when it comes to the hospital means, again, there will be a lot of specialties will be there. Okay, so like pediatrics, oncology, cardiology, neurology, nephrology, and total around, in my hospital itself, total around there are 24 or something specializations. Okay, and where Harika ma'am, she's working in that hospital, it will be much bigger. Okay, so yeah, specialties are there. So, and to become a specialized pharmacist in one particular area, for example, if you are interested to become a cardiac specialized pharmacist, so what you have to do is, at first you have to enter into the hospital first. Okay, so first entry is the important thing. So anyhow, we have to enter into that hospital. At first, they won't give you that specialized position. At first, we have to enter. And for 2 years or 3 years, we have to work as a generalized pharmacist, which means that you need to cover each and everything. Okay, so and all the general wards. So we have to get that experience. And after gaining that experience, then there will be they will give the rotation list. Okay, so your interest, you have to put your expression of interest in that. Okay, so once you put that expression of interest, so if there is an availability in the cardiology department, then at first for the 6 months they will send you for experience in the cardiology department. Then after that, what they will do is they will apply. There will be residency positions also for the hospital pharmacist residency. So which means that 2 years you will work as a resident in one of the specializations. So 2 years you will work only in the cardiology as a resident. Then you will become a cardiology resident pharmacist, means a specialized pharmacist. So in that way, further we can keep expanding our like we can keep improving ourselves. Okay, so those things that we can do in the hospitals.
Thank you so much, sir. You explained it clearly. Thank you so much. I understood.
Yeah, you're welcome.
Hello, sir.
Yeah. Hi, Vijay.
I just have the APC, we have got the skill assessment through mail, but I didn't get any letter from them. So should I have to apply for the outcome letter?
No, not letter. When once you have got the positive skills assessment through email, so that is confirmation. So that's clearly it indicates that you are eligible now to sit for this OPRA examination.
Okay. So
Okay.
the mail is enough. No
Yeah,
need
that
of the
mail.
letter.
Yeah, that mail that you get from the APC saying
Yeah.
that we have reviewed all your documents and you are eligible to sit for the OPRA examination, and you can book the examination slot whenever you are ready. So that's the one. Based on that, you can book the examination slot.
Okay. So I
So
have to
Ria
write the
is
exam for November.
Sorry, Vijay.
I want to write the exam for the November.
Okay.
So, is it okay that the skill assessment was done last year in
It's
May?
okay. Like the skill assessment, once you have done, it will be valid for almost 3 to 5 years. 5 years time will be there. Okay, minimum 5
Okay.
years time will be there. So you can sit for that exam at any time.
Okay. Thank you.
Sir, I have a question.
Yes, Suraj.
Hello.
Yeah, you're audible.
Hi, my name is Chetan.
Oh,
And
hi.
just wondering, I'm just wondering, actually, I have a very long gap since I completed my bachelor.
Mhm.
So just need like your guidance and tips, like how can I, cover all those things? And yeah,
Yeah, so you regarding that gap, you don't worry. So
okay.
you leave it to us, because I can give you two best examples. Back in 2024 July, there was a gentleman. So his name was Raju Patel.
Yep.
And can you guess his age? He was 65 years old.
Oh my God.
Yeah, he did his Bachelor of Pharmacy before I was born. So before in 1980s, so he did his Bachelor of Pharmacy.
It must be surprising for
Wow,
you as
what a
well.
great example, sir. What a
Yeah.
great example.
So like he called me and I spoke to him before he enrolled with us.
Yep.
at
Yeah.
Accredited.
Yeah.
So he called me and he spoke to me, and he was saying that like it's really a inspiration story when we listen to his story. Like it's really a inspiring for all the candidates, those who are preparing for these examinations. So he did back in 1980s his Bachelor of Pharmacy, and then he was not in touch with the subject. So he worked in pharma industries in India, and then he moved to South Africa. So he was there in South Africa again, like in not as a pharmacist, so just in some other sector. And then now what happened was his daughter and son, they both are in IT sector, so they both are in Australia. So he wants to come to Australia and stay here with them, but he doesn't want to stay at home. He wants to earn by himself, and he doesn't want to be like a dependent on them. Okay, so that's why he called me and he spoke to me. He was saying that, so this is my situation, Mr. Arief, so what do you recommend? Then I told him, look, Mr. Raju Patel, so what you can do is just you can start, and you can observe like 2 or 3 lectures. Okay, then after that you will come to know that how difficulty this examination it is, or how easily that you can crack this examination. So everything that you will come to know, so just attend for at least 10 lectures, then you can decide what you can do. So he did the same thing. He joined, and then after 1 month, 2 months, then I just keep on following him. Okay, so I kept on following up with him, so how his preparation was going on. Then he was saying that, oh, now it's quite simple and easy, I can understand each and every concept. So finally he gave the examination and he cracked the examination in the first attempt. So like, if he has done at 65 age, and also there is one more candidate, she's from Germany, her name is Janet. Okay, so her video is also there in our YouTube channel. So her age is 60 years, and she moved to Australia like 25 years ago. She moved to Australia, and since then she was working like as an accountant or in some other sector. And now at the age of 60, she decided to become a pharmacist in Australia. So she contacted us and she enrolled, and she prepared for 3 months, and she also cracked the examination in the first attempt. So age gap is not at all a factor. So 100% you will clear this examination in the first attempt, guys.
Hello.
Yeah. Hi, Hafsa.
I wanted to ask that currently I'm on the dependent visa on behalf of my husband, and we're living in Brisbane.
Okay.
But I recently came for a holiday to India, and I recently joined you guys. So I wanted to ask that whether if I give the OPRA exam from Brisbane or from India itself,
You can give it
which is
any
better?
way. It doesn't matter. If you want, you can give the exam from India also. Okay, so it doesn't matter.
Okay. So how many months prior should we book the exam for the center?
So for the examination booking, the slots will open mostly, now it is March. So in the mid of like at the end of April or in the first week of the May. Okay. So but when once it is opened, then everyone, like there are 500 students are there in the group. So everyone, they will keep posting.
Okay.
Then you can book
28th of April, sir.
28th
of April, sir.
Okay.
Okay. So one last question is that my husband's visa is being changed, and he's on bridging currently, but I'm here in India, so
Okay.
I'm just waiting for the visa to come. And before I go to Australia, I wanted to write this OPRA exam in July. So I wanted to ask that should I wait till November, or should I give my exam here in July?
You can give the exam in July itself. Why do you want to wait? Okay.
Like if I get the visa, I need to go there, so I cannot change my center, right? Just prior 1 month or 2 months before.
You can change it. You can apply for that. Okay. And again, you can apply. You can you can send an email to them. Okay, saying that I'm traveling, so I just want to change my center to Brisbane. Okay. Then in case if there is availability is there, then APC will accept your consideration, and they will definitely give you a chance to change it.
Okay.
It depends on the availability, but otherwise only it's a matter of 1 month. So clear the examination there itself in India, and then you can the next day itself, after writing the exam, if you write the exam, then the next flight you can take and you can come to Australia.
And I can hopefully after passing the OPRA exam, I can continue my internship on this visa also, like dependent visa also.
Yes, on dependent you can continue the internship, because on dependent means you have the working rights. You will get the full working rights. Okay?
Yeah.
When you get the full working rights, then 100% you can do the internship.
Okay.
Okay, so there won't be any restrictions for you. So you 100% you can do the full-time internship. You can work full-time.
Okay.
Means that you can do your time internship.
Okay, thank you so much.
Yeah. Yes.
Sir, we can get student visa and then we can finish our internship. Is it possible?
Yes, that is also possible. Yes, that is also another option, the last option. So what you can do is, so some of them, they are also doing that pathway. So like you can take any student visa. While taking the student visa, in the sense, I won't recommend you to join in masters in pharmacy. Don't take the admission in pharmacy. If you take the masters in pharmacy, per each semester, for example, I'm telling about the Monash. Okay, so Monash University, per each year, every year they will charge around like $50,000 to $60,000 per each year. Okay, so for 2 years means $120,000, 120K from Monash University. So it will be a huge amount. So don't try to do such type of the mistakes. Okay, so if you want to move to Australia on a student visa, then take those courses that are very less expensive. Okay, so there are few courses that will cost only, like, the cost price itself, like it will be $30,000, but they will provide some scholarship. After scholarship, it will cost like around $20,000 or $25,000. Okay, so such type of the courses that you have to take, and at first you have to enter into Australia. So once after entering into the Australia, then what you have to do? So you will be having 2 years of visa, that is the student visa. And after this 2 years of student visa, you will be having 3 years of post-study visa. So total 5 years, 5 years of visa in your hand. Okay. So what you can do is you can start looking for the part-time internship. So most of the candidate now here, all these which are here in the picture, okay, so who have successfully become the pharmacist here in Australia after clearing that internship. So no one had the full permanent residency with them. No one had the PR with them. Okay, so they were on either on the student visa or any sponsorships. Okay, or 407. So everyone's situation was the same. Okay? So even if you come as a student, okay, so what they did was, so they have searched for the part-time internships. Part-time internship means 3 days you can work in the pharmacies. Okay, so 3 days you can work, that is 24 hours per week. Okay, so 3 days per week you can work in the pharmacy. So they did the part-time internship. Instead of doing 5 days per week, they worked 3 days per week and they have cleared the internship. So it takes some time. Instead of finishing it in 10 months, it will take like 15 months or 16 months. So doesn't matter. As long as you get that internship position, the part-time internship position, so you are in a secured place. Okay? So which means that you will be 100% secured. So with that, when you finish your internship, and you become the pharmacist, once you get that pharmacist tag, okay, fully licensed pharmacist tag, then there are many pharmacists who are ready to sponsor you. The pharmacists, they may not be ready to sponsor the interns, but the pharmacists, they are ready to sponsor the fully registered pharmacist. They need the fully registered pharmacist. Okay, so 100% you will get fully settled here in Australia once you get the pharmacist tag with you. Okay, so that's the thing that you can plan for that. Or also from Australia, if you want to move to New Zealand, okay, if you are a registered pharmacist, then you need not to clear any further exams. Just through trans-Tasman route, Australian license will get converted into New Zealand license. No exams and nothing. Okay, and if you are in New Zealand and if you want to move to Australia, again through same trans-Tasman route, your New Zealand license will get converted into Australian license. So which means that you need not write any further examinations. Easy pathway. Easily you can convert the license from New Zealand to Australia and Australia to New Zealand. So these are the few options, guys, that you can think about later. But first, focus on the examination and try to clear the exam. Then after clearing the examination, so you can also think about moving to either Australia as a student, or going to New Zealand as a student, or moving to Australia on a sponsorship, or New Zealand on sponsorship. Okay, so these are the things that we can plan it. Okay, was the examination.
Hello,
As
sir.
you said,
I
Yes.
have a question. Sir, there will be medical examination before entering Australia, right?
Yes, exactly. Yeah.
Will cervical spondylosis hindrance to death?
Cervical spondylosis? No. They won't do anything for that. It's a quite simple one. No. So the main restrictions are, in case if someone has HIV, okay, or someone has hepatitis, okay, so such communicable diseases, if they are present, then there will be some sort of the restrictions. But other normal these things, so no issues at all. Okay.
Hello,
Hi.
sir. Can I ask
Yeah.
you a few questions, sir?
Yes, Ria.
So I did ask in the chat already, and the team did help me with the answer, but I wanted to see if there's a way through this. So whenever I open the app to see the lectures, it logs out every other screen and windows. So I wanted to take notes simultaneously when I hear the lectures. Is there a way we can work through that?
Yeah, sure. I will let the team know about it. Ashutosh, are you there? Ashutosh?
Yes, sir. We have addressed it that it is a feature that we have to protect the app, and for further queries, we can connect with the admin team.
Okay. So
Okay, sorry.
Ashutosh, later you can connect with Ria, and Yeah, so just have a look through what's the things.
Yes, sir. And another question was the handouts that are already given from the previous batch. Are they still valid, or would there be few changes to it? So can I bulk print them in
Yeah,
advance?
you can print them, so no issues at all. Okay, because most of the changes that what we will mention, so we don't do any further changes in the handouts. Okay, from now. Okay, so for this batch, the handouts they remain the same, so we don't make any changes in the handouts. So just the only thing is that in the lecture, while teaching the lecture, so if there are any updates, then we will let you know. So only 1 or 2 extra points will be there. So those extra points, like, you can write it on the same handout.
Okay, perfect. Thank you so much.
Yeah, you're welcome.
Hello, sir.
Yeah, yes.
Sir, I want to ask that do allied expertise help in further procedures like helping us to apply for the expression of interest and further processes which does not make us face any difficulty for pursuing for immigration?
Okay, so we will help you in that thing. Okay, but we don't guarantee you in getting the visa. Okay, so one thing to be quite clear, so we are not the immigration agents, so we just help you in clearing these examinations and guiding you in the path. Okay, so as we can help you, so, or we can also connect, we can give you the contact numbers of the authentic lawyers, okay, so who are in Australia. So you can straight away, you can contact with them, and they will charge very less fees when you compare to the other competitors in the market. Okay, so they'll charge a very less fees, and through them you can approach them, and you can apply for you can lodge for the visa processing and so on.
Sir, I want to ask a question that after clearing the exam, how much time will it take for us to migrate to Australia?
It completely depends upon you guys. Okay, so for example, after clearing this OPRA examination, the first thing is you will apply for 2 categories of the visa, but is the 491 and 190. Okay, so those are the permanent residence pathway visas, and for that permanent resident pathway visas, okay, only whenever the government they have they have that quota allocated, then only the government it will give, that is the immigration department, it will keep giving the invitations. Okay? So these 2 are the permanent resident pathway, means straight away from India itself you will get this PR, permanent residence. Then you need not to be dependent only on those permanent resident pathways. Okay, so you must also keep looking for the other pathways like 407 visa. So for that, what you have to do, you have to keep sending the emails to all the pharmacies owners in the Australia. Okay, so requesting them, saying that you have successfully cleared this examination, and you have to show a highest English score. Okay, then only they will show much interest in your resume, especially speaking score should be much higher. Okay, then only they will show much interest in your resume. Okay, so you have to show the highest speaking score, and also the resume should be in a proper format. Okay, then the owners, in case if it is also not quite simple. I'm not saying that if you apply today, then by tomorrow morning you will get a phone call from Australia. No, it's not like that. So you have to apply for at least 100 pharmacies. Okay, then out of 100, 1 will respond. Okay, so this is quite common, guys. You should never get frustrated. Out of 100, only 1 person will respond, 1 owner will respond. Okay, so that thing, it happened even to me. I have applied for many pharmacies in Australia by the time when I was looking for internship. So in all the pharmacies in Tasmania, I have covered. All the pharmacies in South Australia, I have covered. All the pharmacies in Victoria, I have covered. Then finally, I got 1 opportunity. Okay, so that is quite common. Okay? So we should keep on trying. Okay, through 407 pathway as well as 482 pathway and the other sponsorship pathways. Okay, so if not, finally take any small course, low budget course, okay, the master's course, and then enter into the country. And after entering into the country, you can do the part-time internship. So with that, what happens is, when once you enroll as a part-time internship, then once you finish the internship, then you will become the pharmacist, fully registered pharmacist. with that fully registered pharmacist, if you lodge the visa as onshore, then you will become as an onshore, not the offshore candidate. So you will become the onshore candidate. As an onshore candidate with a pharmacist license, when you lodge the PR, then 100% one day definitely you will get that PR. Okay? So these are the few things that we have to keep it in consideration.
Sir, will
So
you
Preet,
also help us in CV writing and cover letter generation?
Yeah, I will help you in those things. Okay, so after your examination, I will conduct the free session. Like even for the previous batches, also I have conducted the free resume sessions. So I will help you in those things. Okay, like how to prepare a proper resume and what are the things that owners they look in your resume. So those are the things that I will highlight and I will show the sample resumes. So with that, you guys can prepare the resume.
Sir, one last question. As I had some additional certificates like AI, Python in pharma, and an advanced course in computer application, will it help me in my future in Australia?
It may or may not be useful, but yeah, so it doesn't matter. But the main thing what the pharmacy owners they look here is, so the first thing is we have to enter as an intern. Okay, so getting internship position is the first challenge. So for that internship position, what the owners they look is the resume format. That resume should be perfect. Okay, so because here in Australia, I'm telling, because even I have many pharmacy owner friends. Okay, and also in the hospitals, like even while taking the interviews, I used to be one of the interview panel members. Okay, so we spent hardly 30 seconds to read your resume, only 30 seconds. Okay? So because if we post for 4 interns positions in the hospitals, so they will get around 100 applications. So to screen those 100 applications, so we'll spend only 30 seconds time. Okay, 30 seconds to screen one application. So which means that by opening the resume, so what are the main things that they will see? Okay, so those are the things that I will explain you. I will conduct one like free webinar like thing, and then I will explain you like what are the things that the owners they will look, or what are the things that the in the pharmacy, mainly the directors or the deputy directors. Okay, so while hiring the intern pharmacist or while hiring a pharmacist, so what are the things that they will mainly look in the resume? So those things that I will highlight and I will explain you. Okay, and especially internship. So internship means it is hard to get in hospitals. Okay, so hospitals, overseas candidates, they never get the internship. Okay, so it is a like it is a universal truth. Okay, so getting internship in the hospital is highly difficult, but the only main chance is getting the internship in community pharmacies. So the reason why you won't get the internship in the hospitals is, so in hospitals, all the intern positions will be booked by the Australian students. The students who are studying in Monash and RMIT, in other universities. So all those university students, they will book those internship positions. Okay, because from year 2 itself, they will keep coming to the hospitals for hospital rotations and so on. And they will maintain a good rapport with the pharmacy staff members, and they will get that positions. Okay? So that's why getting internship position in hospitals is highly difficult. Highly means highly difficult. Okay? So you should not get disappointed by looking for the hospital positions, intern positions in the hospitals. And at the end of the day, if you don't get any position, then you should never get disappointed. So the only opportunity is in the retail pharmacies, in the community pharmacies. So for that, I will conduct a webinar after your exam. Then I will discuss all the important key points that what they want, especially when they look at the resume. The first 3 bullet points that they will look at your resume. So with that 3 bullet points, they will keep throwing all the papers aside. Okay. So if there are 100 resumes, so out of 100 resumes, if they need only one candidate, so they will throw all the 95 resumes aside. Okay. And they will select only 5 out of 100. So those things are highly important to secure a job in Australia. Okay, so I will conduct a webinar and then I will discuss it with you guys. Any further questions now?
Sir, how
as
to
I'm
become
willing,
a clinical pharmacist?
Yeah.
How to become a clinical pharmacist, sir?
To become a clinical pharmacist, so one thing, so it is not quite easy to enter in the hospitals in Australia, okay, to be honest, because all the students, those who have studied here locally in Australia, means Australian students, so their main target is they want to enter into hospitals. Okay, no one will be ready to go and work in the community pharmacies, in the retail pharmacies. Okay, so everyone they want to enter in the hospitals. All the students, if there are 100 students, those who have passed out, okay, all the 100 out of 100, at least 95 they want to enter in the hospitals. Okay? Only 5 out of 100, so they will have their interest in the community side, because in the future they want to run the business. Okay, so they want to own their own pharmacy and they want to run their own business. So in that way, few of them they will go up over there, but all the other remaining members, they keep on looking for the hospital positions. So that's why there will be a huge competition in the hospitals. And to enter in the hospitals, you have to have a very high skills. Okay, and you need to keep attending a lot of interviews, and even in the interview, each interview will last for at least 45 minutes. Okay, there will be 3 or 4 panel members will be there. Okay, so they will sit and you have to sit in front of them, and everyone they will keep asking the questions. Okay, so those are mostly they will screen your clinical skills, clinical knowledge. Okay, so they will check if you have any experience as a hospital pharmacist before. The main thing is that any hospital that you go, okay, so they will ask only one question: have you worked in Australian hospitals before? Okay, so no, how can we work in the Australian hospitals before? Because we are from India, we moved to Australia from India. How can we work as a pharmacist in the hospital before? So this is the first question that they will ask. With that itself, they will keep screening our resume, and they will say that, oh no, we want someone who has some Australian hospital experience. So this is what it happened even with me. I have applied many hospitals after I became a pharmacist. Okay. So then I had to sorry, someone's mic is on. Sorry guys, someone's mic is on. Okay.
Hi Abdul, please.
Yeah.
Hi Abdul. Yeah.
So even I applied for a lot of hospitals. Then initially I didn't get, after I became a pharmacist, to my goal was also to work as a clinical pharmacist in 2019 itself. Okay. In 2018, 2019, I cleared my internship. Then after clearing the internship, immediately I started looking for the hospital positions. Then I had to struggle almost for 6 to 8 months. Okay, I had attended a lot of interviews, many rejections. Okay, then finally in one of the regional Victoria, I got the opportunity. So I was there in the regional Victoria for almost 2 years or 3 years. Okay, and then again I moved back to Melbourne, which means that here you see, to get that hospital experience for 3 years, I sacrificed my life in a rural area, okay, in a small village pharmacy, in a small rural hospital in Victoria. Okay. So, and then after getting that experience, when I applied in Melbourne hospitals, then all the hospitals, like they were, they gave the invitation to me. Like even I was interviewed at the Royal Melbourne Hospital. Royal Melbourne Hospital means that is the Australia's top #1 hospital. Okay, so I gave the interview there. So I went there personally, and they interviewed me, and then they said that they will give the decision, okay, in few weeks or few months. Okay, but by then what happened? I got the opportunity from other hospital. That is the Northern Health Hospital, where currently I am Then after I joined the Northern Health Hospital, then they send me the email saying that congratulations, you have selected for the position that where you gave the interview at Royal Melbourne Hospital. But already I got I started working here and everything was settled. So that's why I didn't move to that hospital. So this is how, like at first we have to gain the experience. So for that, we have to sacrifice a lot of things. And even I have done a lot of other courses also. I became a consultant pharmacist here in Australia. After becoming a pharmacist, then I started doing the consultation pathway. So I became a consultant pharmacist, and also I did a lot of other courses like online, which are related to the hospital. I become a member of the SHPA and did few courses in the SHPA. So all those are the things that helped me to gain the position as a clinical pharmacist. And then slowly I was going up, and finally I ended up with a grade 2 year 4 clinical pharmacist now.
Hello,
So,
sir.
sir, I heard that we have to do a separate course of clinical pharmacist to become a clinical pharmacist in
No,
Australia.
there is no such course at all. Actually, there is no such course at all. It completely depends on, even if you do the course, okay, there's no guarantee that you will get the hospital position. Even because I'm in the recruitment, one of the members in the recruitment panels, okay, so in the hospitals, so there is no guarantee at all. Like even if you do the course, there is no guarantee at all that you will get the clinical pharmacist job in the hospitals. As those courses, yes, you can show them, at least I have done something, but it completely depends on the interview that you face. As I mentioned, that interview will be minimum 45 minutes interview, and they keep on asking a lot of questions. They will give the cases also. You have to solve those cases, okay, the case scenarios instantly, that you have to solve the case scenarios, and you have to explain them what happened to this patient and what action plan that you can take without opening any books, without referring any books, that you have to tell that what further action plans that I can take. So all those things that we have to tell to them.
Thank you, sir.
Yeah, you're welcome. So any further questions, or can we end this session for now?
Sir, I am going to pursue for OPRA in 2027.
Okay.
And can I completely rely on the OPRA path after my graduation, despite thinking of any other alternative in India?
Yeah, so one thing, you can start preparing for the OPRA examination, and also in the upcoming next few weeks, we'll be conducting the workshops on Canada PBC as well as the Ireland. Okay, so you also attend those workshops, and you can see that you can also see that what are the opportunities there in those countries. Okay, so then you can decide, okay, so which one would be the best option for you.
Hello, sir.
Yeah.
Sir, I just want to apply for an assistant pharmacist in the meanwhile, clearing the exam.
Yeah.
So we do have to submit the resume and the cover letter as well for the pharmacist.
Just the resume and the cover letter, okay? And you have to tell them that I'm interested to work as an assistant pharmacist. So in your pharmacy, can you please consider my application?
Okay.
Yeah.
Hello, sir.
Yes, Nimra.
Hello, sir. Nice hearing from you. Sir, I'm interested in the March examination held like on 24th March. How was it?
Sorry, Nimra, March examination?
Yeah, this March 24 examination. How was it?
It
Any
went
news
well.
from the candidates
From the
that they have
candidates.
given the information?
Yeah. So all the news that we will show once they get the result. Okay. So like all they have done well. Okay. So all the March candidates, they did well. They performed well in the examination, and just waiting for the results. So once again, we will show with the results. Okay. So just waiting for the results, but yeah, everyone, they did well.
So the questions that have came in the examination, so you are fully sure that you have covered all the topics related to them?
All the
Like
topics.
the information you have got from them?
Yeah. So all the topics were covered. So what will be the things that we taught to them? Okay. So based on those concepts, they got the questions.
Okay, thank you, sir.
Yeah. You're welcome.
Good evening, sir.
Okay, guys.
Hi, Bhavya.
Sir, I'm sorry, I would like to take a moment.
Yeah, sure.
Sir, I'd like to know which state is currently PR friendly for pharmacists, sir. And also would like to know where the job market is much better in finding an intern pharmacist or a pharmacist role easily.
Yeah, so there is no such state that is only restricted for the pharmacists. So sometimes Victoria will give a lot of invitations for pharmacists. Sometimes NSW will give, sometimes Queensland will give a lot of invitations. So it keeps changing. Okay, so there is no such only particular state where we can keep looking out for the pharmacist positions. So that's the thing, like you need to keep trying for all the states. Okay, so it completely depends on what will be the state that opens for the invitations. So that state will give the opportunity to you. And in terms of pharmacist, which state would be the best? All the states are the same. Okay, so any state that it doesn't matter, because for internship, when you are doing the internship, the pay rate will remain the same all over the Australia. For everyone, the pay will be $29 to $30 is the current pay rate. Okay? So it remains the same for everyone throughout Australia. Okay, so there won't be any changes in that pay rate. Okay? So which means that it doesn't matter. So all the states, they remain the same. But the difference it comes where exactly the difference it comes here is, if you are in regional areas, rural areas, then the pay rate will be a bit high. Okay, so in which sense it will be high? The main thing is it will be high, especially when it comes to the extra allowances. Okay, so they will give the free housing allowance in regional areas. Okay, so which means that you need not to spend any money for rentals. But if you are looking for the job in Melbourne, Sydney, Brisbane, or any other metros, then they won't give any allowances. So which means that we have to pay out of our pocket the rental prices and so on. So those are the factors that we have to keep it in consideration.
Okay, sir. Thank you, sir.
Yeah, you're welcome.
Yes, sir.
Yes.
Sir, mostly we'll get a chance of doing the internship under a sponsor of community pharmacist, right?
Yeah, exactly.
So, sir, will be there any accommodations through them, or we have to find our own?
No, like as I mentioned that if you go to a remote area, regional area, then definitely they will give some accommodation to you. Okay, so they will give some accommodation. Accommodation means it will be a sharing accommodation, at least the sharing accommodation they will give, which means that you need not to spend any money for the accommodation, because the main money here in Australia, it will be gone through housing rentals. Okay, so minimum rental every month, it will be on average, I'm telling you, the small house, it will cost around 2,000 Australian dollars. Okay, so $2,000 only for the rent. But if you stay in those regional areas, then the employers, they will provide the housing allowance, or they will give the accommodation. Okay, so which means that you will save those $2,000 per month. Okay, so that's the main advantage of staying in the regional areas.
Okay, sir. Thank you.
Yeah, you're welcome. So, well, guys, now let's end this session for now. Okay, and in case if you have any queries, any further questions, okay, so you can send any messages to the team members, or else if you are already with us in Elite Expertise, then you can text the message in the WhatsApp group. But anyhow, from tomorrow onwards, officially, we are going to start the classes. Okay, so which means that we will be in contact with you, in touch with you like every day. So if you have any further questions, then you are welcome. You can ask those questions at any time. So once again, I would like to thank everyone for joining this session. And yeah, so with a full spirit, let's start the course preparation, and you guys will crack this examination. I'm 100% sure that everyone will crack this examination in the first attempt for this July. So thank you so much.
Yeah, so
Thank you.
thank you
So much,
for
sir.
your wise words.
Thank you, sir.
Yeah. So guys,
Thank you, sir.
thank you for attending this session, and you can connect with our
Thank
admin
you, sir.
team. The numbers are flashing in the chat box. Aishwarya Srikumar, one of our admin managers, she has posted the numbers. You can contact through them. And for more informational stuff, you can go through our website. We have a dedicated website where we post regular content related to overseas pharmacy licensure exams, especially for OPRA and intern. And you can also connect through our YouTube channel. We have a dedicated YouTube channel where you can get to learn a lot. We often post related to OPRA and latest updates that you should know about. So thank you for joining this session. And here we are going to sum it up. Thank you, guys.
Thank you.
Thank you, sir. So tomorrow the class will be the same time?
You will get notification in group.
Okay.